Picture this. It's 6 a.m., the alarm goes off, and you know that in the next 12 hours, you'll save lives, comfort patients, and communicate with dozens of people in English.
Whoa, that's intense right from the start.
That's the reality for nurses working in hospitals around the world, and today we're diving into something really special.
We're talking about English in nursing. The phrases, the situations, the real conversations that happen every single day in hospitals.
Whether you're a nursing student, a practicing nurse, or just curious about healthcare English, this episode is for you.
So grab your coffee, get comfortable, and let's explore the world of hospital nursing together.
Hey everyone, I'm Lisa, and I'm so excited to be here with you today.
And I'm Mike. Before we jump in, we want to say a huge welcome to all our new listeners out there.
Yes, if this is your first time joining us, welcome to our learning family. We're so happy you're here.
And hey, if you're enjoying our conversation so far, do us a big favor, hit that subscribe button. It really helps us create more content like this.
Absolutely. And don't forget to give this video a thumbs up. It lets us know you're finding this useful.
And please share this with any nurses or healthcare workers you know who are learning English. They'll thank you for it.
All right, Mike, let's get into this. So, nursing English, where do we even begin?
I know, right? There's so much to cover, but I think we should start right at the beginning of a nurse's shift.
Ooh, good idea. So imagine you're a nurse arriving at the hospital for your morning shift. What's the first thing that happens?
Well, you usually have what's called handover or shift report. This is where the night shift nurses tell you about the patients.
Exactly. And this is super important because you need to understand everything about each patient's condition.
Right, so during handover, you might hear phrases like, patient in bed 5 had a stable night, or the gentleman in room 302 needs close monitoring.
Yes, and here's something really important. Nurses use very specific language to describe patient conditions.
Can you give us some examples?
Sure. Instead of saying the patient is okay, nurses might say the patient is stable or vital signs are within normal range.
Ooh, vital signs. That's important vocabulary. Can you explain what that means?
Of course, vital signs are the basic measurements that show how a patient's body is functioning. We're talking about temperature, blood pressure, heart rate, and breathing rate.
So if you're taking over a patient's care, you might ask what were their vital signs during the night?
Exactly. You're catching on fast.
I try. So what happens after handover? What does the rest of the morning look like?
Well, nurses usually do something called morning rounds. This is when you visit each patient to check on them.
And what kind of English do you use when greeting patients in the morning?
Great question. You want to be friendly and professional at the same time. You might say, "Good morning, Mr. Johnson. How are you feeling today?"
That's warm and caring. I like that.
Thanks. And then you'd listen carefully to their response. They might say, "I'm feeling better today," or "I didn't sleep well. My back is hurting."
So you really need good listening skills, not just speaking skills.
Absolutely. Listening is just as important as speaking in nursing. You have to understand what patients are telling you about their pain, their symptoms, everything.
That makes total sense. What if a patient is describing pain? What kind of language is used for that?
Ooh, this is really important. Nurses often ask, "Can you describe your pain for me?" Or, "On a scale of 1 to 10, how bad is your pain?"
The pain scale, I've heard of that.
Yes, it's such a useful tool. And patients might say things like, "It's a sharp pain," or "It's more of a dull ache," or "It's a burning sensation."
Wow, there are so many different ways to describe pain.
There really are, and as a nurse, you need to understand these descriptions to help the doctor diagnose and treat the patient properly.
This is fascinating. So what happens next after you've checked on all your patients?
Well, throughout the day, you're administering medications. This is called medication administration, or giving meds.
And I bet there's specific language for this too, right?
Oh, definitely. Safety is everything when it comes to medications. You always confirm the patient's identity first.
How do you do that?
You say something like, "Can you please tell me your full name and date of birth?" This confirms you have the right patient before giving any medication.
Smart. You can never be too careful.
Exactly. And then you might say, "I have your morning medications for you," or "This is your antibiotic for the infection."
Do nurses explain what each medication is for?
Yes, good nurses always do. You might say, "This pill is for your blood pressure," or "This injection will help prevent blood clots."
That's so helpful for patients to understand what they're taking.
Absolutely. And if a patient asks questions, you need to be able to answer them clearly. They might ask, "Will this make me drowsy?" Or "Should I take this with food?"
Those are really practical questions, so communication is happening constantly.
All day long. And it's not just with patients. Nurses are constantly talking to doctors, other nurses, therapists, technicians.
Oh, wow. So what's that communication like? Like when you're talking to a doctor?
Good question. When speaking with doctors, you need to be clear and concise. You might say, "Dr. Smith, Mrs. Garcia in room 405 is complaining of chest pain. Her blood pressure is elevated at 160 over 95."
So you're giving specific information, not vague descriptions.
Exactly. You don't say she's not feeling well. You give exact symptoms and measurements.
That makes sense. What if it's an emergency? How does the language change?
In emergencies, communication becomes even more direct and urgent. You might call out, "I need help in room 310," or "This patient is having difficulty breathing."
I can imagine the adrenaline in those moments.
It can be really intense, but good communication can literally save lives in those situations.
Wow, that's powerful. So let's talk about something else. Documentation. I know nurses have to write a lot of notes, right?
Oh my goodness, yes. Documentation is a huge part of nursing. We have to record everything that happens with each patient.
What kind of things do you write?
Well, you document the patient's condition, any changes, medications given, treatments performed, and the patient's responses to everything.
Can you give an example of how a nurse might write a note?
Sure, you might write something like 0900 hours, patient states pain level 6 out of 10 in lower back, vital signs stable, pain medication administered as ordered.
So it's factual and includes specific times.
Yes, very factual, very specific. You're creating a legal record, so accuracy is crucial.
That's a lot of responsibility.
It really is, but it's also really important for patient safety and continuity of care.
Continuity of care. What does that mean?
It means that when the next nurse takes over, they can read your notes and know exactly what's been happening with the patient. Everyone is on the same page.
Ah, that makes total sense. So it all connects back to that handover we talked about at the beginning.
Exactly. You're seeing the full picture now.
I'm learning so much. Okay, so what about when patients have visitors? How do nurses communicate with family members?
Oh, this is such an important topic. Family members are often worried and anxious, so you need to be especially compassionate.
What might you say to them?
You might start with, "Hello, I'm Lisa, and I'm taking care of your mother today," to introduce yourself and establish trust.
That's warm and reassuring.
Thanks. And then you'd update them. "She's doing well today, she ate a good breakfast, and her vital signs are stable."
Good
What if they
question.
ask more
You
detailed
answer what you
questions?
can, but sometimes you might say, "That's a great question for the doctor. He'll be doing rounds this afternoon."
So you know your boundaries, what you can and can't discuss.
Absolutely. And you also have to protect patient privacy. You can't just discuss a patient's condition with anyone who asks.
Right, there are privacy laws.
Exactly. In English-speaking countries, we have HIPAA in the US and similar laws elsewhere. You might say, "I can only discuss the patient's condition with authorized family members."
That's so important. Okay, let's talk about something that might be challenging.
What if you have a patient who doesn't speak English well?
This is really common in hospitals, and it's challenging but so important to handle well.
What do you do in that situation?
Well, first, you speak slowly and clearly. Use simple words. Instead of saying, I need to auscultate your lungs, you might say, I need to listen to your breathing.
Yeah, auscultate is a pretty complicated word.
It is. Medical terminology can be confusing even for native English speakers.
What else can you do to help patients who struggle with English?
Many hospitals have interpreter services. You might say, I'm going to call an interpreter to help us communicate better.
That's a great resource, and it ensures the patient really understands what's happening.
Exactly. Patient understanding is crucial for their care and safety.
So let's talk about some specific procedures. What about when you need to take blood or start an IV?
Okay, so when you're about to do a procedure, you always explain first. You might say, I need to draw some blood for lab tests. You'll feel a small pinch.
Warning them about what to expect.
Yes, it helps reduce anxiety. For an IV, you might say, I'm going to start an IV line in your arm. This will allow us to give you fluids and medications.
Do patients usually ask questions about these procedures?
Oh, yes. They might ask, will it hurt? Or how long will this take? And you answer honestly, but reassuringly.
That's a good balance, being honest but not scary.
Exactly. You might say, you'll feel a quick stick, but it only lasts a second.
What about after a procedure? What do you say?
You might say, all done, you did great. Or, that went very smoothly. How are you feeling?
Positive reinforcement. I like that.
It makes such a difference. Patients remember how you made them feel.
That's beautiful. Now, what about mealtimes? I'm sure there's communication around food, too.
Oh, definitely. You might ask patients, did you eat your breakfast? Or, are you having any difficulty swallowing?
Why is swallowing important to ask about?
Great question. Some patients have swallowing difficulties, which can be dangerous. We need to know so we can order the right diet consistency.
What do you mean by diet consistency?
Well, some patients can only have pureed food or thickened liquids. You might explain, the doctor has ordered a soft diet for you. That means no hard or crunchy foods.
So you're helping them understand why they're getting certain foods.
Exactly. And you're also documenting how much they eat. You might write, patient consumed 75% of lunch.
Curiously, why is it important to track how much they eat?
Because nutrition is a huge part of recovery. If someone's not eating well, that's important information for the healthcare team.
This is all so interconnected.
It really is. Everything a nurse does affects the patient's overall care.
Okay, so we've covered a lot of the day shift activities. What about when it's time to end your shift?
Ah, yes, we're back to handover. But now you're giving report to the next nurse.
What kind of information do you pass along?
You'd say things like, Mr. Chen in bed 8 had his dressing changed at 1400 hours. The wound is healing well. He's due for pain medication at 1800.
So you're telling them what happened during your shift and what needs to happen next.
Exactly. You're setting them up for success. You might also mention, he's been asking for his daughter. She said she'll visit this evening.
Even the personal details matter.
They do. People are people, not just medical conditions. The emotional and social aspects are important too.
That's such a compassionate approach to nursing.
Thank you. That's what good nursing is all about, treating the whole person.
I love that. Now, before we wrap up, can we talk about some emergency phrases, things nurses might need to say urgently?
Absolutely. In an emergency, you might shout, Code Blue, room 320. That means a patient needs immediate resuscitation.
That sounds intense.
It is. You might also call out, I need the crash cart, or someone call the doctor, stat.
Stat, that means immediately, right?
Yes, it's from Latin statum, meaning immediately. You'll hear that a lot in hospitals.
What other urgent phrases might you hear?
During a code, you might hear start chest compressions, or charge the defibrillator, or push 1 milligram of epinephrine.
Wow, there's so much specific language in emergency situations.
There has to be. When seconds count, everyone needs to understand exactly what to do.
This is incredible. Lisa, you've given us such a comprehensive look at English and nursing.
I'm so glad. There's honestly so much more we could talk about.
We could do a whole series on this.
We really could. Maybe we should.
So let's do a quick recap for our listeners. We've covered shift handovers, patient rounds, taking vital signs, administering medications, talking to doctors, documentation, communicating with families, procedures, meal times, and emergencies.
That's a packed episode, and we've learned so many specific phrases and vocabulary words.
The important thing is that nursing English is all about clear, compassionate communication.
Beautifully said, Mike. It's about being understood and understanding others, especially during vulnerable moments.
And it's not just about medical terminology, it's about human connection.
Emotionally, exactly. That's what makes nursing such a special profession.
This has been such an enlightening conversation. I feel like I could walk into a hospital and at least understand what's happening.
Well, maybe don't try to take anyone's blood pressure just yet.
Fair point.
But seriously, I hope our listeners, especially nursing students and nurses learning English, found this helpful.
I'm sure they did. And you know what? Even people who aren't in healthcare probably learned something today.
That's true. We all interact with healthcare at some point. Understanding this language can help everyone.
Absolutely. All right, everyone, we're coming to the end of our time together today.
Thank you so much for joining us on this journey through a day in a nurse's life.
We really appreciate you spending your time with us.
And before we go, we have a very important request.
If you found this episode helpful, please subscribe to our channel. We have so many more topics coming up.
Yes, click that subscribe button so you don't miss our next episode.
And please share this video with anyone you think might benefit from it. Nursing students, healthcare workers, anyone learning English.
And we absolutely love hearing from you. Leave us a comment below telling us about your experiences.
Yes, if you're a nurse, tell us about a memorable moment from your shift. Or if you're learning English for healthcare, tell us what challenges you face.
We read every single comment, and your stories inspire our future episodes.
And if you have specific questions about nursing English or any other topic, let us know in the comments.
We might feature your question in an upcoming episode.
All right, everyone, take care of yourselves.
And to all the nurses out there, thank you for your incredible work. You're heroes.
Until next time, keep learning, keep growing, and keep communicating.
Bye, everyone. Stay healthy and happy.